Medical Education 2. The Foundation Program. The Foundation Program is a 2-year training program which forms the bridge between university-level study at medical school and specialist or general practice training. If it consists of a series of placements, each lasting 4 months, which allow the junior doctor, known as training, to sample different specialties. For example, pediatrics. Pediatrics. A year 1 training FY1 correspond to pre-registration house officer PRHO post and a year 2 train FY2 to senior house officer post. Each training has an educational supervisor who ensures that more senior doctors deliver training in different ways, including clinical and educational supervision. To progress, trainers have to demonstrate a range of clinical competencies, which are assessed through observation in their workplace. People in medical education. Tutor. An academic or, in some cases, a postgraduate student who leads tutorials. Demonstrator. In anatomy teaching, someone who demonstrates how to dissect. Demonstrators are often postgraduate students paying their way through medical school. Lecture, senior lecturer, an academic with teaching and research responsibilities, who contributes to the teaching of a particular discipline. Professor. A senior academic with teaching and research responsibilities for a particular discipline, usually a leading figure in their discipline. College tutor, a consultant responsible for delivering a college training program. Clinical trainer, a consultant assigned to training who provides training during periods of direct clinical care. Educational supervisor, a consultant who supervises a trainee's period for training. Medical qualification, BMSc or BMed-Sci, Bachelor of Medical Science, a degree often taken after 3 years of medical studies by students who may wish to follow a career in medical research. MB, MBCHB, MBBS, BMBCH, BMBS, Bachelor of Medicine, Bachelor of Surgery, bachelor degrees are undergraduate degrees. This is the first degree for UK doctors. MD, DM, Doctor of Medicine. DRCOG, Diploma of the Royal College of Obstetrics and Gynecology. MRCP, MRCS, Member of the Royal College of Physicians or Member of the Royal College of Surgeons. Doctors become members by successfully completing the assessment procedures in the college. FRCS, FRCS Ed, FRCS Glass, FRCSI. Fellow of the Royal College of Surgeons and of England. Other colleges are indicated by the letters which follow. For example, Edinburgh, Glasgow, or Ireland. How doctors become a fellow depends on their college. For the FRCS, further examinations must be passed. For other colleges, it is by nomination or work assignment. The overseas doctor types of registration to manage and treat patients in the UK. All doctors must register with the General Medical Council (GMC). There are several types of registration. Provisional registration is for doctors who have just qualified from medical school in the UK or from certain European Economic Area (EEA) member states. Full registration is for doctors who have completed their year's clinical training. Limited registration is for international medical graduates who have not completed the equivalent of a year's clinical training in the UK. Specialist registration is for doctors who have completed specialist medical training and have a certificate of completion of training (CCT). The GP register is a register of all those eligible to work in general practice in the NHS. PLAB, before they can obtain full registration, some categories of overseas doctors are required to take the Professional and Linguistic Assessment Board (PLAB) test. PLAB is designed to ensure those who pass can practice safely at the level of a SHO in a first appointment in UK hospital. Part 1 consists of a written test of knowledge, skills, and attitudes. Part 2 is an objective structure clinical examination OSCE. It consists of 16-minute clinical scenarios, known as station, to assess professional skill. PLAB Station and Advice. OSCES. Assess these skills. Clinical examination. Your ability to carry out a physical examination of simulated patient and an actor trained to play this role will be assessed. Uncomfortable or intimate examination will be carried out using mannequin, an anatomical model. Practical skills. You will be assessed on practical skills such as suturing and giving intravenous injection. Communication skills. Your ability to interact with a simulated patient, or in some cases the examiner, will be assessed. Skills tested may include breaking bad news and giving advice on lifestyle. History taking. Your ability to take an accurate history and make a reasoned diagnosis will be assessed. Advice on the station from successful candidate. Read the instruction outside each station carefully. You have 1 minute for this. Don't forget the ABC airways, breathing, circulation protocol in every emergency station. Keep in mind safety precautions, like throwing the sharps in the sharps bin. Check the patient understand what is happening. When asked then about any concerns they may have, don't just give a lecture. Listen carefully to what the actor says. Note: sharps are needles and blades which must be disposed of safely in a special container called a sharp beam.